Well, a couple of years ago, Katie and I went to a dinner and we learnt about obstetric fistula, and we decided that we wanted to do something, and so we joined together and decided that we wanted to do a walk, and so that's what we're going to do.
Two young women are planning to walk 430 kilometers from Auckland to Cape Reinga for a beautiful cause. Katie and Jo were inspired by the work of Dr. Catherine Hamlin, an Australian obstetrician and gynecologist who's the co-founder of the world's first dedicated hospital for fistula sufferers in Ethiopia's capital city, Addis Ababa. As a result of being in labor for up to a week, many women in developing countries don't survive. For thousands more, their baby is stillborn, while the women are left with severe internal injuries and also with serious nerve damage in their legs and feet. It's estimated that obstetric fistula affects 100,000 women each year.
Obstetric fistula is the result of a prolonged obstructed labour, where a lady can be in labour for 4 days or more. Baby will be born stillborn, and she will also become permanently incontinent of urine and sometimes bowel contents.
When Katie and Jo, both in their early 20s, found out about the problem of leaking women in Africa and other developing countries, they felt a real calling to do something to help.
Well, the fact that Jo and I both came up with the idea to do the walk separately, and then discovered that, it was something that was both on our hearts, that sort of told us something. The walk has been confirmed, I think, by God that, it's what we want, what He wants us to do.
Women in developed countries are able to access appropriate healthcare when childbirth becomes complicated. In countries like Ethiopia, the women are only helped by older women or their mothers during labor, and if there's a problem, the closest medical professional could be as far as 400 kilometers away, a similar distance to the one that Katie and Jo will be walking in September.
We want to represent the journey that so many of these girls actually take.
There's this girl who ends up at the fistula hospital, and she's got a letter in her hand from her doctor, and it's all grubby and a bit ripped up, and Catherine Hamlin asked her, why is it all dirty and stuff, but she then reads the date, and it's dated 7 years earlier, and what had happened was the girl had been begging on the side of the road for 7 years, just waiting to get $20 to catch the bus up to the hospital.
Lack of education, early marriage, and having an undernourished body at childbirth leaves women in developing countries at a severe disadvantage. Many girls are married as young as 12 and are expected to raise a number of children.
It makes me feel different emotions, I guess. Pretty sad for the girls that do suffer from it. I feel really lucky that I live in New Zealand where I don't face that issue myself, and then I feel a call to action to help these girls just because I have the ability to do so.
It's really hard. I can't really put myself in their shoes. I can't understand what they go through, so that's basically why Katie and I are doing this journey and the distance we're going, to try, at least in a little way, represent what they're doing.
The journey won't be a walk in the park for Jo and Katie, as both have recently undergone knee surgery.
Yeah, well, I snapped my ACL, which is a ligament in my knee, playing soccer last year, and then got surgery after my cricket season in February. Then Jo decided to follow suit, and she broke her knee while skiing on the slopes of Whistler in Canada, and so she had surgery just about a month later after me. She was back home a few weeks later, and now we're training. We're both rehabbing fine. I've got a little bit more to go, and Jo's almost there, I think. Yeah, I think God's probably helped out in a way to get us both back in the same country and working together on it.
As they walk from Auckland to Cape Reinga, Katie and Jo will be visiting a number of schools, churches and community groups to raise awareness about the growing problem in young women around the world. They will also be showing the film Walk to Beautiful. The award-winning documentary is about the work of Dr. Catherine Hamlin and her late husband Reg Hamlin, how they started their pioneering work and how they established the world's first dedicated fistula hospital in Addis Ababa. The film tells the story of 5 young women who undertake the long journey from their remote villages in the Ethiopian countryside to the hospital that they hope will save their lives, under the care of Dr. Hamlin and her staff.
Childbirth should be a joyful occasion. You're bringing a baby into the world. But for them, it's become a nightmare and a horror.
She's in her late 80s and still doing surgery, so it's got to be something God has given her, and she just relies on it every day. Hopefully one day Katie and I will get to Ethiopia and possibly meet Catherine Hamlin and just see the work that's going on there.
Just a simple surgery can fix them for life. I'd love to see more and more of these women having that opportunity.
It's because it's such a preventable thing. There's a midwifery program that's set up, and we're just kind of hoping that more and more midwives can be trained and sent out to the villages to stop fistula from happening rather than having to cure it.
Sing grace as we the sound that saved wretch like me. I once was lost, but now I sure